Layla here, your pharmacist. Today I am going to talk about a question I am asked all the time as a pharmacist, and I know that all my pharmacist friends out there are asked this question, and that is, how do I take this? Can I take this with my other medications? Can my kids take this? Is this safe for the conditions that I have? And how to answer this question is actually all right in the drug label. So all drugs that are over the counter have labels that are regulated by the FDA. So they're built in the exact same way. What we're going to do today is we're going to dive into how to read a drug label together, and that way you can carry this information on with medications that you have at home. Even more importantly, give the medications to your kids. Today we're going to be talking about adult medications. I'm going to go through two of them together with you, and I can do another one on understanding kids' labels and kids' dosing. So let me know if that's something that you would like to see, and let's get right into it. Okay, so what I have here is an 8-hour pain reliever called acetaminophen. This is the generic for Tylenol. Next, we're going to go to the back of the bottle. I have the active ingredient of acetaminophen. And the active ingredient will also say the drug name in generic form and the strength. So you have 650 milligrams in each caplet. You could see the list of approved uses for the medication. Next, you're going to want to look at the warnings. So it does have a liver warning. The maximum daily amount of acetaminophen is 4,000 milligrams in 24 hours. So you cannot take more than 6 of these without harming your liver. It tells you not to take with other drugs containing acetaminophen, or you would have to just lower the amount of these that you're taking. There should always be an allergy alert, so if you've ever had an allergic reaction to acetaminophen, don't take this. As you can see who this drug is distributed by and where it's made. And then here you have the lot number and the expiration date. It's so important to know what your lot number is and not, peel off the label or to put this in some sort of other container and dump this out, because if there is a recall, you will not know if your product is recalled unless you can find your lot number, okay? And then as always, the expiration. So you don't want to use drugs past their expiration point. And then peel here, we'll get some more information. All right, so there's a lot of important information in here as well. So drug facts continued. If you're pregnant or breastfeeding, ask a health professional before use. And if you overdose, you should call the hospital. Especially if you have your child, you think that they took a ton of Tylenol, take them to the ER immediately. The directions for use. So adults and children 12 years of age and older, take 2 caplets every 8 hours with water. Swallow whole, do not crush, juice, spit, or dissolve. Do not take more than 6 caplets in 8 hours. Do not use for more than 10 days unless directed by a doctor. Okay, so everything that you need to know is right here on the label. We have a Mucinex night shift. Okay, this is for severe colds and flu to take at nighttime, and all-in-one medication. So when you're sick and you don't want to be taking a ton of pills, you can take this all-in-one medication for cold and flu symptoms, and it will show you, even on the front, it shows you the ingredients in there. So you have acetaminophen, dextromethorphan, which is a cough suppressant, phenylephrine, which is a nasal decongestant, and then triprolidine, which is an antihistamine, and that triprolidine is what's going to help you sleep. When we open up, we can see the active ingredients in each 20 mLs. So we have acetaminophen 650 milligrams, so that's a pretty high dose for being in a combo product. We have dextromethorphan at 20 milligrams, phenylephrine at 10, and triprolidine at 2.5 milligrams. And it shows you the uses right here, so it's for symptoms of cough and runny nose and sinus congestion. And then it will have your warnings, so it has a liver warning. Why? Because it has that Tylenol in it. So same as what was on our Tylenol bottle. It will have an allergy alert. and also severe throat warning if your sore throat is severe for more than 2 days and accompanied by fever, headache, rash, nausea, or vomiting, consult your doctor. The reason for this is that you might have something going on that is way more than what you think it is. And so if you are not getting better after taking this medication, go see your doctor. It also says do not use if you're taking an MAOI. Those are drugs for depression, psychiatric problems, or Parkinson's disease. And ask your doctor if you have any of these: liver disease, diabetes, thyroid, trouble urinating, breathing problems, chronic cough, heart disease, high blood pressure. So the high blood pressure warning is for that nasal decongestion in there, the phenylephrine. That can raise your blood pressure even more. So avoid using this cough and cold product. There are a lot of cough and cold products that will have the designation HBP after, and those are for high blood pressure. Measure only with the dosing cup provided. Take a look at the inactive ingredients. It's important here if you have any allergies to dyes, because this does have blue number 1 and red 40. A lot of people are allergic to red 40. Thank you so much for watching, everybody. I hope that helped you. I want you to always take care of yourself. I want you to be safe, and I want you to be healthy. So leave any comments and questions that you have below. Have a great day. Bye.